And today we're going to talk about Invisalign versus SureSmile versus regular braces, whether that's right for you and that's something that we can help you with. Hi, I'm Dr. Brett Langston, and this is Oakley. I'm the owner and prosthodontist at Dental Implant and Aesthetic Specialists here in Brookhaven, Georgia.
Down in Brookhaven, with a smile shine bright, Dr. Brett Langston's working late into the night. With hands steady and a gaze so keen, he's the best on prosthodontist you've ever seen.
So braces used to be a thing where only kids, you got, fourth graders through eighth graders trying to get their teeth straight, making space for the permanent teeth to come in, moving teeth around. That's actually a thing of the past. It's not only for children anymore. Now we have a lot of kids that get braces, absolutely necessary. You have to line those teeth up and make room for everything. But a lot more adults now are getting orthodontics. And with the invention of the clear aligners, whether you've heard the term Invisalign or SureSmile, that's another treatment option that we now have in our bag of tricks, if you will, to help move the teeth. A lot of orthodontists are using the SureSmile or the clear aligners in pretty amazing ways to move the teeth. So that's one option we have. So why get braces as an adult? Great question. A lot of times, once we get older, our teeth start to shift and move. As we lose the bone support, the teeth get less and less anchorage in that bone, and so they want to drift and shift. You've probably seen it in your own mouth. A lot of times your lower front teeth start to kind of crowd in and lean over each other. And in addition to that being unaesthetic for some people, it also presents a problem because as those teeth shift and move, all of a sudden they're starting to hit in off angles and hit in ways that they're not designed to hit. So you could have gone your whole life, all of a sudden you hit 55, 56, and all of a sudden your front teeth are hitting funny, and your bite just doesn't feel quite right. And a lot of times that will lead to chipping and fracturing of those, especially bottom front teeth, because they're smaller, kind of less strong teeth. So the options you have in the past would be you'd go to an orthodontist and they would put big old brackets and bands and metal train tracks in your mouth, and it could be uncomfortable to say the least, in addition to be aesthetic. Very few people want to be 55 years old showing up to work with a mouthful of braces. But now we've got the option with clear aligners. And clear aligners, in our practice, we primarily focus on the smiling, I call them the social six, these front teeth, maybe a little bit more towards the back. But with Invisalign, we can actually upright teeth, get them back in line, and get them back in a supported way to where when you bite and chew, they're functioning correctly, in addition to aesthetically lining them up. So the way the system works is we come in for what we call a pre-orthodontic evaluation. So you come in, we take pictures, we take x-rays, we take a cone beam scan, we look at your jaw joint, we look at your condyles, we look at your mouth, we look at everything to make sure that your teeth and mouth are healthy. Because if you have, let's say, periodontal disease, which is where the bacteria in your mouth attack the bone around your teeth, and we try and move those teeth around, they're gonna lose a little bit more bone. And so if you treat periodontal disease with orthodontics, you're setting yourself up for failure. You might get the teeth in the right place, but they're going to be a little bit loose, and they're probably going to end up losing those teeth earlier than you would have had you not done the orthodontics. And so not everybody is a candidate for braces, and so that's why it's really important you need to come see us or another dental office or an orthodontist so they can do a proper evaluation to make sure we're not setting you up for failure down the road. But assuming your teeth are healthy, you've got good bone levels, you don't have active decay, because again, if you have cavities and we move those teeth around, it's not going to be healthy long term. We need to address that. So once we've got your teeth healthy, everything taken care of, we can take a look at your mouth, and we'll do the intraoral scans and x-rays, and then we sit down with an orthodontist and we design out your case. So we take a look at where you are now, and we digitally recreate where we want those teeth to be. Thanks to technology and the scientific advancements, we can actually calculate out how long it will take us to move those teeth in a slow, controlled manner. So we've done SureSmile treatment on almost all my team members here, and even my own family members. So I've got some good tips and tricks for making the process go smoother, because anytime you're moving teeth, if you had orthodontics in the past, or you've had family members that had orthodontic treatment, you know that moving those teeth causes some soreness and some tenderness. The nice thing about the clear aligner treatment is that we can slowly move those teeth, and so that soreness is generally kind of focused on the first day or two, but through regimented use of the trays over this time period, we can actually move the teeth exactly where we want them. So you'll wear the trays for 23 hours a day. We don't want you eating in them. We don't want you drinking anything in them because they're not designed to take that force. They're just designed to kind of start shifting those teeth slowly to where they want to be. And actually, I've had a lot of patients say they've lost weight because they didn't want to go through the hassle of taking it out to eat something, so it cuts down on snacking. So if you're looking for a win-win situation, you can straighten your teeth and maybe avoid a little bit of snacking during the day. But once you're done with the treatment, we put you in retainers that you'll wear at night. And so after that, you go about your business. You put your retainer in at night to maintain that new tooth movement and the new tooth location. You wake up in the morning and you're good to go. So you may have heard of the terms clear liners, SureSmile, Invisalign. They're basically all interchangeable. They're referring to the clear, basically suck down trays that we use to move those teeth. Invisalign is a company that has a patented system that you use their system and you set everything up and their cases are amazing. SureSmile is another system very similar to Invisalign. Same thing, you treatment plan the case, you get the cases. They both end up with the same end result. It just depends on which kind of lab and which system the dentist wants to use. So you can pretty much use the term clear liner, Invisalign, SureSmile all kind of interchangeably. So a good way to think of it is it's almost like using Crest toothpaste or Colgate toothpaste or Tom's. They're all pretty much the same thing. It just depends on which kind of flavor or variety you like. So we recently partnered with a company called Bite that works with the SureSmile system and helps patients with the financing and insurance and to maximize their benefits. So it's helped making braces affordable for more people. It's a really cool program. You come in, you see us, we do a full evaluation to make sure the teeth are healthy, make sure everything looks good, and help kind of plan out the case. So Bite handles all the finances and insurance, so it makes the process go much smoother. So as amazing as the clear liners are, there are definitely lots of cases where conventional braces are necessary. A lot of times the clear liner trays can't really space out teeth as much as we want or can't move massive movement or heavily anchor teeth as much as we want. So there definitely is still a lot of cases where we have conventional orthodontics with the braces and the metal. It's nice to know we have different options if that's available. So the majority of my patients that come in wanting braces definitely prefer the clear liners. It's a little bit less obvious and it's easier to kind of put into your normal life. And if you've got a small gap or something tiny that we're moving, most likely we can do clear liners. But if you've got a big gap or massive tooth movement, we're going to determine what the best treatment plan for you is. Cost-wise, they're equivalent, so it's not a moneymaker for us if we push you towards conventional braces or versus clear liners. It really is what's in your best interest and what's going to get the end result that we all desire. I'm Dr. Brett Langston, and this is Oakley, and we're here to help you watch your mouth.